Good morning, everyone. I'm Na Luo from Bernathen Center Institute of Automation, Chinese Academy of Science. Today, the title of my talk is Brain Function Structure and Genetic Data are linked but show different sensitivity to duration of illness and disease stage in schizophrenia. The presentation will include the four parts. First, as we know, different stages of disease will bring diversity to schizophrenia. There has been many previous studies about first episode and chronic stages. However, many of these studies are based on one single imaging modality, for example, functional connectivity, chromatic volume, or DTI. So, in this way, we cannot directly tell how those changes from different modalities are correlated with each other and if the sensitivity to duration of illness and disease stages across modalities is different. Multimodal fusion is a method which can combine different modalities together and applied to analyze the schizophrenia from different views. There has been many multimodal methods developed by previous studies. For example, the MCC plus joint assay, MCC with reference plus joint assay, and parallel assay. So, in this study, first, we adopted a three-way parallel assay to combine the brain function, structure, and the genetic data together. And second, based on the linked structure function genetic pattern identified from the multimodal fusion method, we can further compare the modality-specific sensitivity to the disease progression. This is the framework of our study. First, we selected three features. The SNP feature, which were overlapped with the PGC's GWAS results with p-value less than 0.01, and the functional connectivity modality, which were computed based on the Atlas template and the chromatic volume. Once SNP, FC, and the chromatic pattern was identified by the three-way parallel assay, and the loading parameters of each modalities will be used to calculate the group difference by using ANOVA across three groups and by two-sample t-test for the pairwise comparison. And furthermore, in order to compare the different impaired speed of chromatic volume and functional connectivity, we first calculate the correlation between the imaging modalities and the duration of illness, and further compare the significance of the slopes. The demographic information are listed in Table 1. All the first episode here have a duration of illness less than 2 years old, and all the chronic schizophrenia here have a duration of illness larger than 2 years old. This is result 1. We identified a joint SNP, FC, and the chromatic pattern using three-way parallel assay. From the scanned plots, we can see either before or after controlling diagnosis, age, gender, and education, the correlations between each two modalities are significant. By plotting the functional connectivity component, we can see healthy controls have a decreased functional the schizophrenia patients have a decreased functional connectivity, mainly in the temporal gyrus, amygdala, parahippocampus, and postcentral, compared to health controls. Also, the patients have increased functional connectivity compared to health controls, mainly in parietal gyrus and cerebellum. The spatial map of the grammatic components are shown in Figure B. We can see the schizophrenia have grammatic volume reduction, mainly in postcentral, amygdala, hippocampus, and the temporal gyrus, but has a grammatic volume increase, mainly in the cerebellum. Both these two image modalities are significantly associated with the SNP components, which highlight the risk genes like CACNO1C, GABA2, EGF, and so on. This is our second result. We compared the different sensitivity to disease stages. Here, the p-values is the ANOVA results for each modality across 3 groups. For the functional connectivity modality, we can see the group difference between healthy controls, first episode and chronic, or health controls and chronic schizophrenia. All the 3 groups are significant. When we look at the grammatic modality, we can see the group difference between healthy controls and the first episode is not significant, while the group difference between healthy controls and chronic schizophrenia, first episode and chronic schizophrenia are significant, which may hint us that the group difference between healthy control and the first episode of functional connectivity was more obvious than grammatic. For the SNP modality, we can see the group difference between the healthy control and the first episode. Healthy control and the chronic schizophrenia are significant, while the group difference between first episode and the chronic schizophrenia are not significant, which suggesting that the comparable risk of genetic component between the first episode and the chronic schizophrenia. This is our third results. In order to compare the different impaired speed between the grammatic volume and the functional connectivity, we calculated the relationship between the duration of illness and the imaging loading modalities. We can see the slopes of the correlation between function connectivity and the duration of illness is significantly sharper than the slope of correlation between grammatic volume and duration of illness. This indeed suggested that functional connectivity presented to be more sensitive to duration of illness than grammatic. So to summarize this, first, in this study, we identified a significant linked image genetic pattern in schizophrenia. And secondly, grammatic and functional connectivity showed evidence of greater deficits at later disease stages, while SNP indicated a non-gradual variation trend with insignificant group difference observed between first episode and chronic schizophrenia. Third, group difference between health control and the first episode of function connectivity was more sensitive than grammatic, and the functional connectivity presented to be more sensitive to duration of illness than grammatic. At last, thanks to my supervisor, Professor Jin Sui, and all the other collaborators. And if you are also interested in multimodal fusion, prediction, and classification, please do not hesitate to stop by the posters listed in this table. And thanks for your attention. Thanks.